Bismillahirrahmanirrahim. Quote of the day: Health is the greatest gift, contentment the greatest wealth, and faithfulness the best relationship. Today, the topic of my presentation is fat soluble vitamins, and I'm presenting it under supervision of my professor, Dr. Sanal. Learning outlines. It includes introduction, what are vitamins, types of vitamins, fat-soluble vitamins that are A, D, E, and K, their sources, functions, daily intake, deficiency, disorders, and prevention, and recent updates and MCQs in the end. Learning outcomes. By the end of this presentation, participants will be able to describe the introduction, sources, functions, daily intake, deficiency, and disorders, and prevention of fat-soluble vitamins. What are vitamins? These are defined as small organic molecules present in diet which are required in small amounts. Most of them are not synthesized in the body and hence they must be supplied in the diet. However, few vitamins are synthesized in the body, though most of them are present in diet. As such, some are present as precursors. The precursor forms of vitamins are called as provitamins. In the body, these provitamins are converted to vitamins. Classification. They are divided into two groups: fat soluble vitamins, which we are going to discuss in detail today, and the second division is of water soluble vitamins. Vitamins are essential for growth, maintenance, and reproduction. They are not used for energy production. Fat soluble vitamins are required for normal color, vision, blood clotting, bone formation, maintenance of membrane structure. And most of water soluble vitamins, which they function as coenzymes or phosphatic groups of several enzymes involved in carbohydrate, lipid, and amino acid metabolism. Vitamin A and D, they act as steroid hormones. Deficiency of fat-soluble vitamins produce night blindness, skeletal deformation, hemorrhages, and hemolysis. This is the picture to show the classification of vitamins. Based on solubility in oil, they are divided into fat-soluble vitamins, and if they are soluble in water, they are called water-soluble vitamins. Among fat-soluble vitamins, we have vitamin A, vitamin D, E, and K. And vitamin D is further divided into vitamin D2 and vitamin D3. And vitamin K is divided into vitamin K and K3. And this is the division of water soluble vitamin, that is vitamin B and C, which we would discuss tomorrow. First, fat soluble vitamin is vitamin A. Vitamin A is an essential nutrient needed in small amounts for the normal functioning of visual system, maintenance of cell function for growth, epithelial integrity, red blood cell production, immunity, and reproduction. Vitamin A deficiency is a major nutritional concern in poor societies, especially in lower income countries. Vitamin A, preformed and provitamins. These are retinoids, which are natural and synthetic forms of vitamin A. Preformed, three preformed compounds that are metabolically active and found in animal products. These are retinol, which is an alcohol form. It is present in animal tissues as retinyl ester with long chain fatty acid. Then second preformed form, we have retinol or retinyl aldehyde, which is an aldehyde form, and it is obtained by oxidation of this first form, that is retinol. Then retinol and retinol, both are interconvertible. Then the third form is retinoic acid, and this is the acidic form which is produced by the oxidation of retinol. Carotenoids. There are more than 600 carotenoids in nature, and approximately 50 of these can be metabolized to vitamin A. Beta carotene is the most prevalent carotenoid in food supply that has provitamin A activity. In humans, significant fractions of carotenoids are absorbed intact and are stored in liver and fat. The alpha, beta, and gamma carotenes and cryptoxanthin are quantitatively the most important provitamin A carotenoids. These are the primary natural sources of vitamin A. Among animal products, we have liver, egg yolk, dairy products, and from the plant sources, we have orange and red colored fruits and vegetables, green leafy vegetables. All these are the natural sources of vitamin A. These are also the food sources of vitamin A, that is fish, egg yolk, green leafy vegetables, pumpkin, mango, cod liver oil, milk. Vitamin A function. Vitamin A plays role in vision, gene transcription, immune function, embryonic development and reproduction, bone metabolism, hematopoiesis, skin and cellular health, antioxidant activity. It protects eye from night blindness. It may lower risk of cancers. That it also serves as antioxidants. It reduces risk of acne, supports cell growth, supports health, promotes healthy growth and reproduction, and supports a healthy immune system. Vitamin A benefits. It strengthens immune system, powerful antioxidant, prevents cataract, combats free radicals, prevent cancer and heart disease, and it reduces acne. Recommended daily allowance for vitamin A for 0 to 6 months. It is it's given as same dosage for male and female. That is 400 RAE, and this capital RAE stands for retinol activity equivalent. Then for 19 to 50 years of age, for male it is given as 900 microgram, while in 700 microgram is given for females. And WHO recommendation in setting where vitamin A deficiency is a public health problem, that is prevalence of night blindness is 1% or higher in children 24 to 59 months of age, or where the prevalence of vitamin A deficiency is 20% or higher in infants and children 6 to 59 months of age. So high dose vitamin A supplementation is recommended in infants and children 6 to 59 months of age. So the target group we have infants 6 to 11 months of age, including HIV positive, and also children 12 to 59 months of age. The dose is given as 100,000 international units of vitamin A for the target group of 6 to 11 months of age, and 200,000 international units of vitamin A are given to the children of 12 to 59 months of age group. And for 6 to 11 months of age group, it is given as a single dose, while for children 12 to 59 months of age, it is given every 4 to 6 months. And route of administration is orally. It is given as oil-based preparation. Vitamin A deficiency. Vitamin A deficiency can be due to inadequate dietary intake, impaired intestinal absorption, chronic alcoholism, and these are the groups that are more prone to develop vitamin A deficiency. These are young children, children with inadequate health care, adults with disease of pancreas and liver, diseases of pancreas, liver, intestine. Vitamin A deficiency. Serum retinol is best used for the assessment of subclinical vitamin A deficiency in a population, not in an individual. So blood concentration of serum retinol are used to assess subclinical vitamin A deficiency. And a plasma level or serum retinol concentration of less than 0.70 micromole per liter indicates subclinical vitamin A deficiency in children and adults, and a concentration of less than 0.35 micromole per liter indicates severe vitamin A deficiency. Vitamin A deficiency disease, it is called hypovitaminosis, and the symptoms are night blindness, corneal drying or cirrhosis, softening of cornea, that is which is also called keratomalacia, and corneal degeneration and blindness. And also the symptoms can be triangular gray spots on eye, which is also called Bitot spots. Treatment and prevention of vitamin A deficiency. Treatment. Nearly all the early stages of xerophthalmia can be reversed by administration of massive doses of 200,000 international units or 110 milligram of retinol orally on 2 successive days. Prevention. For prevention, recommended daily intake is 600 microgram for adults. Diet improvement by regular adequate intake of food rich in vitamin A, and reducing contributing factors like diarrhea and measles. On the other hand, too much of it can be toxic, like it leads to hypervitaminosis, and the symptoms are dry, itchy skin, hair loss, liver damage, skin coloration, loss of appetite, headache, fatigue, blurred vision. And moving on to vitamin D. It is a sunshine vitamin, also known as calcitriol. It exists in two activated sterol forms, vitamin D2, which is also called calciferol, and vitamin D3, which is also called as calciferol. The primary natural sources of vitamin D from animal sources, these are fatty fish, egg yolk, cheese, beef, and the plant sources, these are mushrooms. So vitamin D, the body makes vitamin D when it is exposed to UV rays from the sun. Other sources, food sources are cheese, margarine, butter, fortified milk, healthy cereals, and fatty fish. So this is the picture shows that how pro vitamin D, which is present in skin, when the sun rays strike on the skin, then it is converted to vitamin D3, which is an active form that is called calciferol, and in the liver, it is converted to calcidiol, and in the kidney, it is converted to calcitriol, and from there it goes to intestine, bone, muscle, heart, and cancer, immune system, to boost immune system, pancreas, and these are the proposed non-classic functions, that is chronic disease prevention, heart disease, diabetes, cancer prevention of breast, colon, and autoimmune disease prevention. Function. The major biological function of vitamin D is to maintain normal blood levels of calcium and phosphorus. Vitamin D aids in the absorption of calcium, helping to form and maintain strong bones. It promotes bone mineralization concerned with a number of other vitamins, minerals, and hormones. It maintains normal cellular growth and function. It maintains healthy immune function and preventing excessive inflammation. It inhibits parathyroid hormone secretion from the parathyroid gland. This is the picture to show the functions in a nutshell. That is, it improves heart function, enhances brain development, strengthens the immune system, strengthens muscular function, provides anti-cancer effects, essential for strong bones and teeth. Daily requirements. According to the National Institute of Health, daily requirements varies upon exposure to sunlight. So we can see that vitamin D is more prevalent in areas where people are less exposed to sunlight. And for age group 0 to 12 months, it is given as 400 international units, then 600 international units for up to 70 years of age. And for people greater than 70 years of age, it is given as 800 international units. For pregnancy and lactation, the recommended daily allowance is 600 international units. And for fracture healing, it is given as 400 international units. Vitamin D deficiency. In adults, vitamin D deficiency is defined as a serum 25 hydroxy vitamin D level of less than 20 nanograms per milliliter, and insufficiency is defined as serum 25 hydroxy vitamin D level of 20 to 30 nanograms per milliliter. Risk factors for vitamin D deficiency. These are age older than 65 years, breastfed exclusively without vitamin D supplementation. Those children who are exclusively breastfed for initial time and who do not take vitamin D supplementation, they are very much prone to develop vitamin D deficiency. Third is dark skin, insufficient sunlight exposure, medication use that alters vitamin D metabolism, obesity, sedentary lifestyle. So here we can see that these are the causes of vitamin D deficiency, that is sunscreen, melanin, those who are hyperpigmented, that is dark colored skin, they are prone to develop vitamin D deficiency. Those living at high altitudes, living in winters, and air pollution. And also medication and supplements like anti-epileptics, corticosteroids, rifampicin, they also develop vitamin D deficiency. And all of these are the associated diseases like schizophrenia, COVID-19, respiratory infections, tuberculosis, they all are associated with this. Now, bone softening, faulty process of bone mineralization or deficient or impaired metabolism, these all are due to the vitamin D deficiency, which also leads to phosphate and calcium deficiency. In children, it is presented as group of symptoms that also called rickets, and in adults it causes osteomalacia. Clinical presentation of rickets are skeletal pain and deformities, bow legs, fracture susceptibility, weakness, hypotonia, disturbed growth, ricket rosary, that is prominent costochondral junctions, and Harrison's groove, that is indentation of lower lips, and hypocalcemia. These are the signs by which we can diagnose vitamin D deficiency in children. And in adults, it leads to osteomalacia. which present as diffuse skeletal pain, bone tenderness, fractures, gait disturbances, proximal muscle weakness, and hypotonia. So, what signs of vitamin D deficiency in adults? It is not obvious, but might have mood changes, bone loss, muscle cramps, fatigue, bone and joint pain. Prevention and treatment. Recommended adequate intake based on levels needed to maintain optimal bone health in all members of a healthy population. The current daily adequate intake is 200 international units for infants, children, and adults younger than 51 years of age, 400 international units for adults 51 to 70 years of age, and 600 international units for adults older than 70 years. Natural and artificial latter effective therapeutically, but oral administration is preferred. In absence of exposure to UV light, it can be met entirely by ingestion of vitamin D. Signs of vitamin D toxicity. This is the another spectrum of vitamin D, that is toxicity: headache, metallic taste, nephrocalcinosis or vascular calcinosis, pancreatitis, nausea, vomiting. Contraindications to vitamin D supplementation: these are granulomatous diseases, metastatic bone diseases, sarcoidosis, Williams syndrome. Then we have other fat soluble vitamin, that is vitamin E. It is also known, the other chemical name for it is tocopherol. It was discovered in 1922 and it is a fat soluble vitamin. It is also known as anti-sterility vitamin. It is synthesized only in plants. And these are the animal sources, that is eggs and dairy products, and the plant sources are vegetable oil, fruits, and green leafy vegetables. So vitamin E is found in corn, nuts, olives, green leafy vegetables, vegetable oils, wheat, germ, but food alone cannot provide a beneficial amount of vitamin E, and supplements may be helpful. So function of vitamin E, these are prevention disorders of premature infants, protection and treatment of cancer. That is a very important antioxidant. It helps prevent oxidation of LDL cholesterol, which contributes to plaque building in the arteries. Functions. The main function of vitamin E is antioxidant. It intercepts free radicals and prevents destruction of cell membrane. It protects the fat in LDL from oxidation. It inhibits platelet aggregation. It enhances vasodilation. It inhibits the activity of protein kinase C. So this is the recommended dietary allowance for vitamin E. For 0 to 6 months of age, it is 4 milligram per day, and then it is 5 milligram per day up to 3 years of age, and for age group 19 years and older than this, then it is given as 10 or 7 adequate intake, that is milligram per day. This dose is given, and for pregnant women it is 7 milligram per day, and for lactating women it is 11 milligram per day. So this is the chart for recommended daily allowance of vitamin E. Vitamin E deficiency. It usually happens due to poor diet habits, that is diet deficient of fruits and vegetables, disease related to liver, gallbladder, pancreas, low fat and processed foods. Newborn babies, especially who are born prematurely, might also show vitamin E deficiency, and due to malabsorption of vitamin E in chronic pancreatitis, cholestasis, cystic fibrosis, primary biliary cirrhosis, Bonn's disease, short bowel syndrome. These are the vitamin E deficiency icons, that is anemia, hair loss, muscle weakness, cancer, leg cramps, dry skin, blindness, immune impairment, and fertility problems. This is other picture to show signs and symptoms of vitamin E deficiency. Again, muscle pain, weakness, weak immune system, walking difficulties, chronic diarrhea, vision problems, skin problem, numbness, tiredness. Then we have vitamin E toxicity. Many adults take relatively large amounts for months to years without any apparent harm. Occasionally, muscle weakness, fatigue, nausea, and diarrhea can occur. The most significant risk is bleeding, serious bleeding in the brain. Previous studies may increase the risk of hemorrhagic stroke and premature death. Vitamin E toxicity: high doses can antagonize the action of vitamin K in animals, reducing blood coagulation, increasing vulnerability to bleeding and hemorrhage, but the effect can be reversed by vitamin K injection. Because of the potential for high doses of vitamin E to antagonize vitamin K in humans, persons taking high doses of vitamin E would be prudent to also take vitamin K. Vitamin E deficiency, prevention and treatment. Recommended daily allowance not known, but 0.7 milligram per gram of unsaturated fat in the diet is adequate. Premature infants may be given 15 to 20 international units for 24 hours. Large oral or parenteral doses may prevent permanent neurologic abnormalities in biliary atresia or A beta lipoproteinemia. And this is the last fat soluble vitamin, that is vitamin K. Vitamin K is the only fat soluble vitamin with a specific coenzyme function. It is required for the production of blood clotting factors essential for coagulation. It exists in different forms, that is vitamin K1, K2, K3, and it is also called anti-hemorrhagic hormone. It is phyloquinone present in plants isolated from alfalfa leaves. It has phytalic side chain. This is the features of vitamin K, and vitamin K2 is also called quinone, which is produced by the intestinal bacteria and also found in animals. Vitamin K3, it is also known as manadione. It is a synthetic form of vitamin K, and all the three vitamins K1, K2, K3 are naphthoquinone derivatives, and these are stable to heat, and their activity is lost by oxidizing agents, strong acids, and alkalis. Storage of vitamin K. Vitamin K is stored in liver, also present significant amount in spleen and skeletal muscle. Vitamin K is released to the bloodstream and transported in the blood by associating with beta lipoproteins. These are the vitamin K sources: spinach, asparagus, broccoli, beans, soya beans, eggs, strawberries, meat, and fish oil. Functions of vitamin K. These are coagulation of the blood, mineralization of bone, dentin and cartilage, prevents soft tissue calcification, and cell growth regulation. Blood clotting. The basic function of vitamin K is in the blood clotting process. The most familiar of these vitamin K dependent blood clotting factors is prothrombin. Thus, they can serve as an antidote for the excess effects of anticoagulant drugs. These are used in the control and prevention of certain types of hemorrhages. They are also used in bone development. Specific proteins in bone and bone matrix are dependent on vitamin K for their synthesis and are involved with calcium in bone development. This is the table to show the adequate intake for vitamin K. For 0 to 6 months of age, equal doses are recommended, that is 2 micrograms in men and also 2 micrograms in females. And for 9 to 13 years of age, it is given as 60 micrograms in men and also 60 micrograms in women. While for age group 19 plus, it is given as 120 micrograms in men and 90 micrograms in women. And for pregnant women, it is given as 90 micrograms. Deficiency in newborns or infants is very common because they have sterile intestinal flora and very little vitamin K crossing the placental barrier from maternal circulation. So there is also impaired absorption caused by biliary obstruction or small intestinal disease. Sterile bacteria flora caused by administration of antibiotics results in non-availability of microbial source of vitamin K, and the clinical features of vitamin K deficiency are prolonged bleeding and prolonged prothrombin time. Measurement of prothrombin time is an index of liver function. Liver function is lowered. Prolongation of PT occurs due to deficient synthesis of coagulation factors. So administration of vitamin K restores prothrombin time to normal level. Symptoms of vitamin K deficiency are easy bruising, oozing from nose or gums, excessive bleeding from wounds, punctures, injection or surgical sites, heavy menstrual period, bleeding from GIT, blood in the urine or stool. This is a picture again to show vitamin K deficiency. It presents as bruises in infants, and this is the picture showing bleeding gums in infants due to in adults due to vitamin K deficiency. So vitamin K are used as oral anticoagulants in the treatment of thrombotic conditions such as thrombosis occurring after MI or surgery. Hypervitaminosis, it is due to administration of large doses of vitamin K, and it presents as hemolytic anemia, jaundice, lung teres. Vitamin K antagonist. Dicumarol and warfarin have structurally similarity to vitamin K. They competitively inhibit vitamin K epoxide reductase and vitamin K quinone reductase, which block the regeneration of active form of vitamin K. Antibiotic therapy. Sulfonamides and broad-spectrum antibiotic drugs can virtually sterilize the lumen of the intestine, thus removing an important source of vitamin K. So patients on antibiotic therapy, they can be at risk of vitamin K deficiency. Vitamin K deficiency bleeding. All infants regardless of sex, age, ethnic background at risk of vitamin K deficiency bleeding. This persists until they start eating regular foods, usually at age 4 to 6 months, and until the normal intestinal bacteria start making vitamin K. So this age group is very much prone to develop vitamin K deficiency, that is 4 to 6 months of age. Prevention. On an average day, nutritionists consider 120 milligram adequate for men and 90 milligram adequate for women. So these are the sources of vitamin K, that is green leafy vegetables.